So what do we tell patients about osteoporosis? So let's say, Dr. Jain, you tell a patient you've got osteoporosis, then what's the next set of things to do? Let's start off with, let's say lifestyle. Let's say lifestyle, diet, exercise. Like what kind of things are you telling patients, as you're telling them that you have osteoporosis?
Yeah, so a lot of lifestyle modifications can help improve upon the bone. So part of this is ensuring that a diet that is sufficient in fresh fruits, vegetables. If one eats seafood, then increase amount of seafood. Basically, things that have calcium, natural sources of calcium, including dairy. So making sure that we are getting calcium through the diet, and if that's not enough, then taking calcium supplements can help further augment the calcium levels in the blood. At the same time, making sure that our vitamin D levels are adequate as well. So generally speaking, we are not able to get enough vitamin D through the diet alone. So it is recommended, especially in postmenopausal women, that they take additional supplemental vitamin D, about 600 to 800 international units a day. So that's the diet part. Also, if there is any modifiable factors, so if someone is a current smoker, then if they quit smoking, that can improve their bone health significantly. If they cut down their intake of either alcohol or caffeinated beverages, that improves their bone health as well. And the other aspect that can improve someone's bone health is making sure that they are exercising, doing called weight-bearing exercises. And these are basically, it can be something as simple as brisk walking, which really helps build up the bone mass, and that limits the rate of destruction of the bone.
Oh, that's a good point. I have some patients where they stand at their kitchen counter, they have their hands on there, and then they do these ballerina squats, and so they're saying, I'm using my body weight. So I thought that was very ingenious of them. Okay, so we've got some lifestyle things that we can do in terms of vitamin D, calcium, exercise, diet. Now, what about medications? Dr. Brown, I mean, just like high blood pressure, we do all those lifestyle things, but sometimes we still need medications. What about medications in terms of treatment for osteoporosis?
I think medication is really important for the right person, because what we want to do is prevent a fracture. And I sometimes describe the building of bone like building a wall, and the calcium and vitamin D are the bricks. And you can have lots of bricks, but if you don't have workers, you're not going to build a wall. You can also have lots of workers, and that's medication in different ways, but if you don't have the bricks, you're not going to build a wall. So putting someone on medication does not mean they can ignore the lifestyle things that Dr. Jain just spoke about. Those are really important. But we have a variety of different medications. Some medications build up our cells that are building bone and slow down the cells that are eating away bone. Other medications are stimulants and basically stimulate new bone formation. And there's different categories of drugs. So we're actually very lucky in that we've got lots of choices, and we have good guidelines from Osteoporosis Canada suggesting what is the best first choice. And there's a variety of first choices. That decision to go on medication is really a big decision, because it's not like an antibiotic that you take for 10 days and you're done. It's looking at osteoporosis as a chronic disease, and it's trying to alter the bone biology so that your bone is stronger as time goes on. Because don't forget, if you're on a drug for 5 to 10 years, you're also going to be 5 to 10 years older. And so we know that age itself is a risk for osteoporosis. So there's lots of good choices. It depends on what is the best choice for you as an individual.
Great. It's nice to hear that there are good choices nowadays. I think in the past there weren't good choices. It was just the diet, lifestyle stuff that we're telling people. Now, Dr. Jain, what about patients stopping medications? Because I know that trying to remember to take aspirin or whatever, I tend to forget. So in the case of osteoporosis, how important is it to continue to take it? Because I think a lot of people, their sense is that, well, it's about bone, maybe it's not as urgent as, let's say, blood pressure or something like that. So how important is it that people stay on their medication?
Yeah, extremely important. As you pointed out, Dr. Lin, with conditions like hypertension or heart disease, we know that the medications are important for maintenance of heart health. In the same way, these medications are very crucial for maintenance of bone health. And as Dr. Brown pointed out, as we grow older, the bones are inherently at a higher risk of getting those fractures. So all the more reason for us to continue that medication. I think our understanding of osteoporosis has changed dramatically in the past few years, where we now understand that osteoporosis is a chronic medical condition, something that requires long-term care of your bones, long-term, both the lifestyle as well as the treatment part. So I think it's really crucial that we continue to nurture our bones. And if that requires ongoing medication, then by all means, we should definitely continue on it.
All right, so that's important that people stay on it. I think that's a good message for people that are already on these medications,